Okay, so let me add like another question to it. At what point one need to see a psychologist versus psychiatrist? Because from a common man's perspective, a psychologist and a psychiatrist, they're almost the same, right?
Yes, I get that question a lot. So a lot of times, especially our population, they come to me because I'm a psychiatrist. So psychiatrist means so I've gone into medical school, right? So I have my medical school training, and then after that, I did my residency, specialized in psychiatry. So I'm evaluating more on the chemical imbalance, looking at if there's a need for medication. Okay. Psychologists, in other hands, they have not gone into medical school. They've done basically, some of them have done like bachelor's in psychology and then either master's in psychology or just their straight Psych D, psychology doctorate. So they're just looking at more of the psychological evaluation. They're doing psychological testing. They're doing more on the therapy side, right? They're the therapists.
Right.
So we are more on the easy way to differentiate is we're looking at more the medication management. They're looking at more on the therapy side. Now, there's some overlap occurs because we do some therapy also as a psychiatrist, but that's not our forte. It's more like medication management. So, because yes, I know our community, they come to me thinking that I'm a psychologist, like I'm going to be doing therapy, and which is fine. So the first appointment, they get a little discouraged. And like, I'm talking about medications, like, because I'm already evaluating for that. But I have educated and tell them this is what it is. And then it's up to them if they want to be on medication or not. So what they could do is, it doesn't matter if they go to a psychologist or a psychiatrist, just get help. When you go to the professional, they will guide you. They'll tell you, like, if let's just say they end up seeing me, I'll tell you, like I said earlier, look, I evaluated you. I think this is the treatment you need to look at. You need to go see a therapist, which is a psychologist or a therapist. And then, you also see me follow up because I also feel there's a need for medication. Then if you feel you can come back and I can do med evaluation even further and get you started on medication. But I just say end up seeing a psychologist. They can evaluate them and say, look, I think you definitely need therapy, but the therapy also will you benefit being on medication. So I'm going to refer to you a psychiatrist to get on medication also. So either way, as long as they help.
But the more important thing is to get help first, and then you'll be evaluated based on the severity of it.
From a spiritual perspective, you are on the hind end of the spectrum. And I'll explain to you. There's care, there's maintenance, there is major repair. So, for example, if you have a car, you have to daily take care of it. What does that mean? Put a screen on when you're parking so that he doesn't get in and roast your car. Check your air tire pressure, fill up the gas, fluid for your window wiper. This is care, okay? Maintenance, you're talking about rotations, alignment, oil change. And then you're talking about like projects, engine, transmission, something big. Islamically, from a spiritual aspect, he's that engine transmission specialist that's going to come in. But in our spiritual life, in our Islam, we have the care regimen. What's the care regimen? That every day as humans, we are going to fill up. So I want you to put in your head these boxes. We all have these compartments in our head every day that's there. Okay, one is anger, depression, stress, anxiety, happiness. Just put a whole bunch of boxes.
Right.
Now, what happens is when one of them starts filling up, my anger levels are rising. I'm getting to 90, 95. What happens now is that I'm not in a healthy position. Allah has given us something called sleep. And he talks about وَجَعَلْنَا اللَّيْلَ لِبَاسًا وَجَعَلْنَا النَّهَارَ مَعَاشًا. Okay? وَجَعَلْنَا نَوْمَكُمْ سُبَاتًا. Sleeping at night is therapeutic. Okay? And the thing is, what bothers me, like I finished the class yesterday at 12 o'clock and I had to go grab something. On the way back, across from the masjid, there's this restaurant and people are out there sitting, talking. That's not the time to eat. Our Desi culture, our Arab culture, is a testimony of us actively destroying our mental well-being. From the care aspect, if I don't have gas in my car, I'm harming my engine. If my air tire pressure is low, I can have a major accident. So this is called mismanagement of care. And when we sleep at night, what happens is a lot through the night sleep, which is from 10 to 5. Okay, you got your 7 hours here. you got not only spiritual rejuvenation, physical rejuvenation, but mental rejuvenation. When I wake up in the morning, you know that anger that was hitting at 93, 95, it's zero now. You know, all the levels neutralize. My stress levels, I'm at work, I'm in stress, I got anxiety stuff. But at nighttime, it's supposed to deplete that.
Yes.
Okay. And in the morning, you start fresh again. Of course, you're going to face scenarios, but you have leverage.
Yes.
What happens if we don't sleep at night? And if we don't eat at the right time, what we've done is, what did Nabi Sallallahu Alaihi Wasallam do? Look at his sunnah. There's an Arabic saying, إِذَا تَغَدَّى تَمَدَّى وَإِذَا تَعَشَّى تَمَشَّى. When you eat lunch, sleep. When you eat dinner, go for a walk. So you have to give yourself time to digest the food at night, not eating at 2 o'clock in the morning and sleeping at 3. What happens when we keep the sleep and food regimen in good check? We're mentally, physically able to take on what the world sends to us. That's our daily care. And Allah has given the Muslims a structure of scheduling their life no other religion has. Fajr, Zohar, Asr, Maghrib, Isha is structure of life. You know what you need to do? You wake up before Fajr. That means you have to sleep enough to wake up for Fajr. And then Zohar is call it quits. Asr, call it quits. Maghrib, call it quits. Meaning you have to know when to break away. And prayer in congregation is break away from my work, break away from my stressors, break away from my family, and go and change environment. Because now this is now the maintenance. I'm going from the care to maintenance. Maintenance is where you realize that by being in a situation constantly isn't going to help you. So our religion has given us so many mechanisms of daily care and maintenance that shouldn't take us to constantly jumping to the major projects and overhauls. However, when we're not daily care, now, give example, our kids are not sleeping all night. They're on TikTok all night. They sleep all day. Allah will not allow those levels to reset. So if they slept with 95 anger, they wake up with 96. One small thing happens in the kitchen in the morning, mom goes, now you're waking up, he's tipped 100. Now that anger is going into their anxiety, into their happiness. And so it's just like a flood. And as it floods, there's only one thing that they're doing because everything else, all their other faculties mentally have been compromised.
So it's more kind of a lifestyle and self-inflicted problems that, in fact, they are manifesting on the healthcare side. But now, as we are talking about psychiatric issues, they are kind of directly, I feel, that is correlated.
So, when you go to a therapist or you come to us, those are the things we talk about. And those are the things I evaluate for: sleep, energy, appetite, focus, concentration, because these are important things. And I agree with you. A lot of times, sleep is deprived. Majority of the time, and a lot of our psychiatric disorders are related to sleep. If you correct the sleep, most of them do go away, especially depression and anxiety. But I'm going to add to the point where, let's just say you do all of this. Like you got to your original question, when do you seek professional help? Some of it, most of it is like self-inflicted. But there are times it's not self-inflicted, where these big mechanical things have changed in your brain. It affects your sleep, affects your energy level. So that's how you get that professional help. Let's just say you're doing all these mechanics and you're still struggling. That's the time to get professional help, because that's when the therapist can sit down, give you a little bit more tips, maybe figure out where you're going. If that still doesn't work, then you definitely need to come to us, where that medication comes in place, will help you fall asleep at night, take care of that whole mechanic piece, that it's like there's that imbalance that's occurring, causing for these normal things not to occur. So that's also
absolutely
100%.
That also is there.
You have a new car 100 miles in, and there's making a sound that the tires are not making, the gas stuff. You have to go to the expert. What's going on here? Or you got a problem in your fuel, or you have in your gas line or your engine. So the experts are always on standby, and that's what we talk about, the collaboration, for people to realize something abnormal is happening to me. I'm not able to sleep at night. It's not I'm actively staying awake. I just can't sleep. And that's why you must, as Dr. Saf saying, you must seek out that help.
So it's very important. And so that's why there's a concept called life coaches occurs in America. So they're not exactly therapists, they're called life coaches. This is what they're doing. They're kind of keeping you in train. So I tell we call maintenance therapy. Let's just say you've gone to therapy, you've done this. We recommend you should kind of do maintenance, like every month, or follow up with somebody who kind of looks at the bigger picture, and then see yourself where you are standing, and then kind of come back to that. So yeah, I agree. These life skills are very, very important. The sleep hygiene, eating healthy, exercise, everything plays a role. Everything.
I think a few eye-opening points for myself too. Imam Azhar, how do you demarcate, like somebody comes to you, let's say for a certain XYZ problem, right? At what point you decide or recommend them that this is more kind of beyond counseling or help? You actually need to see a psychiatrist, or you might need to consider yourself for medications. Have you faced any scenarios?
So I learned this from Imam Suhaib Webb. And Imam Suhaib Webb gave me great advice, and he's like a mentor to me and a big brother, that we must know our territory. And we must accept to stay within that territory. And I always talk about lanes, like Toronto has the largest highway, I think, in North America, the 401. I think it's what, 16 lanes, one way each.
Wow.
Each person must stay in their lane. And so for us as scholars, we must recognize and have the ability to identify that this case is beyond my control. And that is why we need to work in collaboration with therapists, psychologists, psychiatrists, that we can say, okay, this has to be referred. So there's a 3-tier system that we had adopted at the masjid at one time, which was, if we get a call that there's a problem, there's one of 3 options. Either this problem will be channeled to the scholar, or it will be channeled to our mental health experts, or it's a 911. And that's why we had operators who would take these calls and be trained to understand where these cases have to go. So system is what I'm alluding to. We must create systems where we're able to bounce off each other, realizing this case is in my head. And you don't just tell them, go to someone else. We must hold their hand and make those connections. That's very important.
Got it. No, that's a very good point. Something we have in healthcare is what we call as triage system, right? When a patient walks in, we decide the severity or the complexity of the problem, and based on that, we direct or channel them to the appropriate care.